Hey, everybody. Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director of the Institute for Healthcare Consumerism, along with CEO and founder of the Institute, Doug Field. Joining us on the program today is one of Mike's colleagues, Lissa Thomson. She's the Senior VP and Chief Consultant at Lockton Benefits. Welcome, Lissa.
Good morning, and thank you.
Tell us, now we just had a conversation with Mike around some of the things that employers need to be looking around exchanges. Kind of give us your brief background there at Lockton, and tell us a little bit more about the industry and kind of where you see the exchange market right now.
Okay, great. Well, as you'd introduced, I'm the chief consultant for the benefits group at Lockton, and my chief role is to lead and help develop our resources with innovative solutions, make sure that those are made accessible to our client consulting teams. My background actually started out in the math and the actuarial side, but I've been doing consulting for almost 30 years. My view of exchanges as they exist in today's market, and I think that we'll see a lot of development over the next few years, is that exchanges work in certain circumstances, but the most critical items that you need to do is develop the need, develop the issue, develop what you're trying to solve for, and make sure that the solution meets all of those needs.
Lissa, this is Doug, and welcome to the program.
Thank you.
Tell us a little bit about the specific client that you want to talk about today. Who they are, the industry, and kind of some issues that you were trying to help them solve.
Great. Okay. Well, in 2013, Lockton developed a very specific private exchange for an industry. One of our clients, Entertainment Partners, had been a client for some 10 or 11 years, realized that the entertainment industry, of which they are a payroller, they're one of the largest depositors of W-2 information to the United States government. They handle a lot of both union and non-union members from a payrolling perspective in the entertainment industry. Mm-hmm. They realized that the Affordable Care Act, or ACA, was going to have a tremendous impact on the entertainment industry. So to tell you a little bit about why they needed an exchange in the industry and why our client felt that a private exchange would be the optimal solution. If you think of ACA and the requirement that you are required as an employer to cover 95%. Now, of course, that's been pushed to 70% for 1 year. You're required to provide coverage to 95% of your population, and that must be qualified and affordable. And you look at the entertainment industry, and I'll give you an example of a multimedia entertainment client. They might handle theme parks, magazines, and productions. And when I say productions, it could be feature films, it could be documentaries, it could be TV shows, it could be reality shows, it could be all sorts of different kinds of productions. They have different staff needs across their industry. So what they distribute for benefits for a theme park or a magazine is going to be very different than production. In production, you have two kinds of workers, union and non-union. About 75%, give or take, of the market is unionized, of those production workers are unionized. So if you think of the directors and actors, the screen actors, the writers, they all are part of unions, but there is about 25% of the production market that is non-unionized and had never had benefits. So if you think of this multimedia industry, that non-union production workforce in almost all circumstances will make up more than that 5% that the government allowed you as sort of a buffer from an ACA eligibility perspective. So they had to go through and say, how am I going to provide benefits for this workforce that I've never provided benefits for? And that's pretty much industry-wide, that the non-union workforce had not had benefits. And you also have to consider that this workforce is highly migrant. I will work on one show for 3-4 months, and then I go to another show. And the successful people in the entertainment industry continually work one production after another. So the management of that workforce and the development of whether or not they're eligible for coverage became a problem. And then how do I provide meaningful benefits for these people when they're literally transitioning from multimedia company A to production company B to feature film or reality TV, and we may have people who go among 7 shows, some of which the shows are owned by the same multimedia company. Sometimes there are 7 different ones. So it's a very, very unique issue in this industry. In early 2013, the CEO of our client, Entertainment Partners, contacted us, and they said, what can we do? We recognized that there were some things that we needed to solve for. We needed to provide some workforce management, some eligibility management. We needed to have a platform that was easy to onboard and offboard as production companies started up for a feature film and then closed down for a feature film. It had to be a process that was fairly simple. And we needed to have coverages or product or benefits for the workers that could transition through the lifetime of their year of multiple productions. So we very quickly realized that a marketplace for the industry was the best solution. Provide something so that when you have a production that's given a budget which will include ACA exposure or requirements for benefits, that you have something that you can plug into. It gets up very quickly, understands the needs of the movement of the workforce, and provides benefits that they literally can take from one company to the next because they're the same benefits and the contributions required for the employees are the same. So if I leave company A, I may be out of work for 2 weeks. I'll pay for that directly. But then when I start to work for company F, I continue the same benefits. If I've met my deductible, I've met my deductible with company F. So we have the seamless transition of benefit platform for the entire industry.
Well, that makes a lot of sense. Now, did Entertainment Partners offer health care benefits before? Or is this a new?
No, they did not. They had never been asked by the entertainment industry to provide benefits. It's a tough nut to crack.
Yeah.
There's a lot of administration, a lot of processes, and a lot of compliance and underwriting that you have to do in the background. So there really had never been a need pre-ACA.
But the marketplace, it also gave them this opportunity to execute this model for their clients.
It did, and when you think about the industry, this was I'll use the word virgin population. They really had never had benefits, so we really didn't know much about their utilization patterns other than through the demographic risk, which we of course could measure. So having carriers come to the table for this was not. It wasn't a 1, 2, 3. There was a lot of development in that process.
That sounds like it. Now, who was your exchange partner in this endeavor?
We actually developed the exchange.
Okay.
Lockton was the principal architect. We got a lot of insight from our client Entertainment Partners relative to the needs in the process development, but we hand-selected benefits administration system, decision support, direct pay advocates, call center services, communications. It was all custom developed because it was such a unique need. We did look at already established exchanges, some of the better known exchanges, but once again, it would have been very clunky because you have to have a very facile onboarding, because when you get a green light for a production, you've got to be ready. No. You can't have a lot of transition. You have to have a process that's built for uploading their eligibility and getting them moving.
Now, Lissa, when you got this up and moving, what was the feedback from one, the employees, but also the associated businesses underneath this group?
Great question. Well, had we not had pushback on ACA on July 2nd, 2013, and then again in February, of course, the more that the government changes the rules, the more the perception or the need is deferred.
Right.
Had we not had the deferral on July 2nd of last year, every one of the entertainment industries would have had to have a solution by January 1, 2014. And we were up and ready, by the way, by January 2014. We were enrolling people last November. but it pushed the need. So right now, we have some big names as clients. I haven't asked for their permission to name them, so I will refrain from doing so. But we have a lot of proposals. The clients that will have to comply in 2015, those who will have an issue with the 70%, and also those companies that realize that to compete now in the industry, they have to offer benefits because the specialty production companies will be offering benefits. So we're going to see a huge uptake in January 2015, barring any additional delays by the government.
Now, Lissa, if what kind of advice would you give, an employer out there or an affinity group who's looking to maybe, put this in play, private exchange?
Well, I think that private exchanges, especially customized private exchanges, are a very effective tools. You have to understand what it is you're trying to solve for. Is it cost? Is it outsourcing? Do you need flexibility? Do you need multiple funding methods? Do you need multiple carriers? What is it that you're trying to solve for? Is it some sort of a transition period? We're doing private exchange, customized private exchanges right now for a number of private equity companies. We also have a large union that is looking to expand a private exchange for non-union clients. So it depends upon the need. I would look very carefully at the commitment that you wanted to make. Some of the established exchanges may be good solutions, but you have commitments and obligations. You need to look at, carrier commitments, carrier obligations as well. There's a lot to be developed in exchanges over the next few years, and I think that they definitely have a good run and a good opportunity to bring solutions to a lot of employers. I, like Mike, believe that customized exchanges, at least in the initial phases, may be to the better benefit.
And one of and we kind of echo that. We actually built privatehealthcareexchanges.com and are updating that with all the different exchanges that roll out. It seems like there's 5 a day that roll out into the marketplace. So it's a fast moving market. So we echo all that you said, and we really appreciate you joining us on the program today, Lissa. Have a great weekend, and to the rest of our audience, stay tuned for Healthcare Consumerism Radio.